observe? After having food, there will be leftover food. The leftover food on the teeth. Did you observe? With your nail, you can observe with your nail. Not now, but after having food, there will be food debris. That means leftover food will be there on your teeth. That is called plaque. If you do brushing before going to bed, the plaque can be removed. The leftover food can be removed. Otherwise, what happens? The leftover food will be there throughout night. That will cause stinking mouth, because your mouth have 100 crores bacteria. How much bacteria? 1 billion, 100 crores. Actually, that is good bacteria. That is useful to us. But if you don't maintain your mouth properly, if you have leftover food on your teeth, that bacteria will act against your mouth. That bacteria will act against your mouth and your health, because mouth is the gateway to your body. Whatever enters, food, it enters to the mouth. Sometimes you breathe your air. Whatever you eat, if you have that bacteria will become bad, that will act against you. So that food will act on the food, leftover food. That will be eating away the leftover food. Slowly the caries will be formed. How many of you found black or brown cavities on your teeth? How many of you found? Have you seen your teeth in mirror? Do you observe your teeth in the mirror? See, what you do with vegetable and fruits, if there is a decay, small hole, black, brown hole in the vegetable or fruit, what do? Small cavity, small decay in the fruit or the vegetable. You answer me. I will appreciate you. What do? You just that small portion to remove, use that fruit. Like that way, if you have small cavity in your mouth, decay in your mouth, if you visit dentist every 6 months, we just remove that cavity, we just remove the decay, and we do filling there. Otherwise, what happens? Even you remove that decay, the gap will be there. The food will accumulate there. So, like vegetable or fruits, if you find a small decay, we just remove and the tooth will be healthy. If the decay is too deep, this is a fruit. If the decay is too deep, what do? Again you will completely remove. Like the tooth also, we do root canal treatment. If the decay is too deep, tooth has got blood vessels and nerves. That is called pulp. Like fruit in between, what is the pulp? Every fruit. Can you imagine? There is a pulp in the fruit. Like that, there is a pulp in the tooth. If the decay goes deep, the pulp will be involved. Once the pulp is involved, we have to do root canal treatment. At early stage, only with filling, that is enough. Filling is enough. If it is advanced, then we have to do root canal treatment. And if you don't care at the time also, whole tooth will be spoiled. Then we have to remove the tooth. See, there are milk teeth in our mouth. Up to 6 years, there are milk teeth, 20 milk teeth. After 6 years, milk teeth will go and it will shed and permanent teeth will erupt. At the age of 12, you have almost 12, 13, you have almost all permanent teeth. At the age of 17, 18, you will have wisdom teeth. Because at the age of wisdom, the tooth erupts, that's why that is called wisdom tooth. Understand? So, tooth is there for lifetime. At the age of 6, you get permanent molar, first molar you get, and front teeth also. Teeth will be there for lifetime. You must listen to this. Each tooth is like a diamond. Each tooth, because nobody will explain you, nobody will tell you. Even you go to doctor, even you come to me, I do not have time to teach you for 1 minute. Tooth is like a diamond. What do you do with the diamond? You keep in almara, you lock it, keep it, very rarely use. But this is diamond you use every day. Understand? Use it every day. Like how hard the diamond is, the tooth enamel is like that. Tooth enamel is very hard like a diamond. If you drink colas, acidic drinks, this will spoil. The enamel will spoil. Otherwise, the tooth if you keep in the soil for 1,000 years, it will not spoil. If you drink colas, it will spoil within few years. So tooth, God has given this tooth for lifetime. But we are spoiling our teeth within a few years. Our doctors must have examined. Every school, 70-80% students have cavities. 2, 3, 4, 5. At that time, if you come to dentist, they can treat you. If you neglect, again you have to go for root canal. After root canal, crowning. See, natural is natural. Artificial is artificial. Natural tooth have, because molars have a they are very strong teeth, and it could able to withstand a lot of stress. If you put artificial tooth, not even 50% or 25% of the strength what natural tooth have. So, in your body, every part is very important. So, you will be caring about your hair, skin, everything. There won't be any infection. If you observe now, almost 70-80% children have dental problems. Because this tooth is connected to whole body. You know why? Tooth has got blood vessels. And even gum has got blood vessels. Even you have gum problem and a tooth problem, that bacteria will travel into your, circulate into your bloodstream every day. You know how much blood is there? That blood will circulate in your blood vessels. So this infection will circulate in the body. Because people say at the age of 50, 60, so I don't have any habits, sir. I don't have smoking, I don't have a drinking habit, or I take very good diet, I do exercise, but I got heart attack. Why? Because they do not have any other infection except teeth. If you see the teeth, 20-30% of the teeth are gone. Decay, gum disease, because of the infections, this will go into the circulation and they get all these problems. That's why you need to brush your teeth every day before going to bed. So that will keep you healthy. And what children are, most of our population do, they just don't brush in the night. Morning they brush, immediately they eat, and again whole day that food will be there in the mouth. When the mouth is clean, there is no time for cleaning mouth, clean teeth. Usually the brushing is after every meal. Like how you wash your hands, you must clean your mouth also. Even after lunch, you need to gargle your mouth. Actually, brushing after breakfast is better, but no time for us. You just run away, you get up late and just get ready to the school. So actually speaking, after every meal. So many children carry chocolates, sweets, they eat all day and it is there on the teeth. You must rinse your mouth. Whatever you eat, just rinse your mouth. And also some bad habits. See, some people they bite the nail. Biting nail is a bad habit. You lose enamel. And they just open their mouth and listen. When you open your mouth, only when you have to open your mouth while speaking or eating food. If you open your mouth the air will go into through the mouth. Mouth breathing. So mouth become dry, you get gum diseases. Because mouth has got saliva. Saliva is very, very important, does very, very important function. It has got all enzymes. Whatever food you eat, the saliva, with the help of saliva, with the help of teeth, the food will be grinded into small particles. There itself, it will be divided into protein, carbohydrates, fats. Because digestive system, the digestion starts from the mouth, not here. You have to grind. It will be small balls. It will make small particles. It will be digested easily. See, if you keep your mouth open and then your mouth will become dry, saliva production will be stopped. Then it will affect the digestive process and also protecting the mouth. Saliva will protect the mouth. It has got good enzymes. It cannot protect mouth because you should keep always your mouth open. Some children have protruded teeth, protruded teeth. They cannot close their mouth. At the age of 12 to 14, if we have protruded teeth or irregular, because your parents cannot find, because they will be there from the day one. They cannot, they think my child is beautiful and nothing is required. But other people at the age of 20, we go to job, or if you want to get married, then other persons will tell you why these teeth are protruded. Protruded is not only for cosmetic, for functional also. At this age, this is the right age, your group, what I am observing here, the children who have the protruded teeth better get it treated, because in this world, beauty is also important. Understand? Your eyes, nose and teeth will make you more beautiful. Anything defect in these parts, opposite person will watch at you wherever the defect is. Eyes, nose or teeth. Understand? Why should you leave protruded teeth? Get it corrected. Because in jobs, because it's competitive world, not only skills, look also very important. That don't leave anything, just get it done. I could see some of the children having protruded teeth already. I could see, but it's not good to tell you who is. So, there are a lot of this thing in a dental preventive or precautionary. There is a lot about this dentistry, but this is this outline. But if you have any doubts, please raise your hand. How to protect or how to prevent, and whether you have visited dentist or any problem. If you raise your hand, I can answer you. Because many schools, the children get up and ask doubts. Understand? So if you have any doubt, please raise your hand. You teachers also. Yeah, please. Yeah. You are waving now? Oh, no, please. I appreciate you. You get one more brush or toothpaste if you ask me doubt.
What is like if they have these teeth in like what is they have to meet the doctors? Like 12 years or 13 years, what is the correct age for them? Correction of the teeth.
Actually, madam is asking what is the correct age for a correction of the teeth. Actually, there is no correct age, but every 6 months you must visit a dentist. Once the permanent teeth starts erupting at the age of 6 years, dentist will observe you, and at the age of 7, 8, 9 also, if there is a protruded or protruded teeth, the small appliances they correct you. But right age is 12 to 14 years. Right age is 12 to 14 years. But at the age of 50, 60 also we can correct. Now there is a lot of improvement. Previously they were using braces. Have you seen braces? But now there is advanced technology that is called one Invisalign technology with that no need of braces also. Just one tray they give you and they have to wear tray. After 6 months we provide trays. After 1 week you can remove the tray and again you can put next tray. There is a lot of advancement in the technology. So you know, instead of braces, now the Invisalign and aligner technology have come. This is very beautiful. Nobody could recognize you what you are wearing also. Within no time, your teeth will be corrected. Okay, madam. Yeah, please. Come. What is your name? Secretary. Because of this, he became secretary. Because he's very bold and came forward to ask doubt. That's why I think you selected him as secretary. Yeah. Yeah.
Silver when they keep it silver. December
Some of them.
keep the tooth, sir. Replace the tooth with silver.
Yeah.
In December
What you are expecting? Not silver, any other metal, you know, any other thing more than silver and this stuff. Yeah. But he is asking if somebody replaces their teeth with silver or aluminium, if somebody lose their teeth, isn't it? If somebody lose their teeth, they replace with aluminium or silver. So actually, if someone lose their tooth, there is a latest technology implantation, that is a titanium material, very, very noble metal. We put in a bone directly, on that we fix with this now tooth colored without any aluminium or silver or nickel chrome. We put with the complete metal free crown. So previously, as you said, as you asked, there was a nickel chromium like a stainless steel material was available. Because of some disadvantages, previously they used to put silver fillings, like in that mercury will be there. Now because mercury is a disadvantage, after few years only in the research they find out. So now there is no mercury, no silver like with here also total tooth color material only, without any nickel chromium. Understand? So good question. You give one pack, toothbrush and toothpaste.
You have more gum problems.
More gum problem. What is actually your question? Why gum problems come or what is exactly your question? See, he is asking what is your name? Jateshwar asking why there are more gum problems. You know why gum problems come? Why? Because lack of proper brushing. Because lack of proper brushing, as I explained to you, plaque will be accumulated on the teeth. Plaque attract. What is plaque? Leftover food. Leftover food is plaque. So that plaque attracts bacteria. Then gum problems arise. That is called gingivitis. Initial stage is gingivitis, like reddening of the gum. Then bleeding starts. If you neglect at that stage, that will go in between tooth and gum. The bone will be resorbed. It will destroy the bone. This plaque, initial stage plaque. Plaque become tartar or calculus. Calculus means, listen here please. Calculus means in saliva you have lot of minerals. That minerals will be formed on the plaque. It will become very hard. That cannot be cleaned. Only dentist can clean that tartar or calculus. Understand? So gum problem arises because of improper brushing only, especially for children. Adults smoking, lot of things, the pan, masala. Adults may use all these things, but children especially brushing. And also while developing permanent tooth will come from 6 years to 12 years, all the permanent teeth will come. So that time also you find some bleeding. But you must visit it at least once in at least 1 year. Actually 6 months, but at least 1 year. See, you have all checkup forms now with you. You have checkup forms with you. Keep those checkup forms with you for next 2, 3 years, 5 years also. We'll do free checkup. Understand? Keep all those forms. Next 2 to 5 years, we do free checkup. No need of paying us consultation. And use the toothpaste. You bring us empty tube, we give you a free tube again. Understand? Just walkable distance from here. Understand? Use that. And next time again come with empty. How many times you use it, we give it free. Understand? Okay. Next. Please come. We are giving them and bag, toothpaste and toothbrush. Okay? What's your name? Ashok.
Hashavan, sir.
పేస్ట్ బ్రష్ రెండు పెట్టుంటే చిన్నపిల్లలు.
Okay. Arsha, tell me.
Sir, while I am brushing, I observed that blood is coming out of my mouth, sir. Is that any problem or what, sir?
Yeah, very good, Arsha. Same question he repeated. You have examined this boy. I think you have examined our doctors. Open your mouth. Yeah, there is a decay here. Decay. This is a milk tooth only. There is a decay. From that, you are most probably from the decay in the tooth contains blood vessels and nerve. That is exposure. Mostly because of that, you are getting blood. But there is a decay. It's not good for your mouth. So for health, come to us. Just we treat that. Okay. What's your age? 12. Okay. Whether we have to check whether the permanent teeth is coming or not there, we will check. We take small X-ray. You come and we will check. Ma. Hey. Come in.
Sir.
Please. Mahesh Chaudhary. Okay. Okay.
Sir, if our tooth are not in correct order, do we get ear diseases?
Ear diseases. See, Mahesh is asking if you don't teeth order. What is asked Mahesh? Mahesh is actually raised very valid and good question. If teeth are not in order, can you get ear problem? It's really very good question because you know why? If teeth are not in correct order, you must have in correct order. If there are not in correct order, because there is bite, vertical height should be maintained. If teeth are in correct order, this vertical height will be maintained. If there are not in correct order, vertical height cannot be maintained. So, you know here there is joint, both sides we have joints, jaw joint, that is called temporomandibular joint. So, if there is not in correct order, if this height is reduced, so you have compression in the joint. You have compression in the joint. You get pain. You think that is heel pain. But this pain should not arise. When you get some pain or something, immediately you visit dentist. One thing. And also, night grinding habits. Some children they grind throughout night like this. Teeth will be spoiled. Then you get joint pain. And one more thing I am telling you, while yawning, all this don't open too widely, your joint will be disturbed. You will get joint problems. Understand? And don't bite too hard things like bone. Till you biting once in bone, teeth will get damaged. And there is a lot of pressure on it. You can bite like meat and all, but not joints. And also like butter is in nuts. So don't bite hard things, but you can have in that very hard nut is there. గట్టిగా ఉంటాయి కొన్ని, అవి అవాయిడ్ చేయండి. Like that, you must try to avoid very hard things, like bone-like things. Understand? Good. See, he is telling he is having adenoids. Adenoids means there is growth in the nose. If there is adenoids, you will have a mouth breathing. Teachers, you must observe your children who is opening their mouth and breathing. They are having mouth breathing. They are having mouth breathing means they have adenoids in the nose, but that will cause a lot of problem. The subject is very long, but short I am telling you. Once they open their mouth and breathe, the jaws will be elongated like bird face. It will become bird face. And also, mouth breathing is not good for health also, I told you previously, but immediately get it corrected. But luckily your jaws are not elongated, otherwise it will become bird face. If there is adenoid, if there is any breathing problem, if you cannot breathe properly, or when you open your mouth and breathe, then you must visit ENT specialist. And also teeth are highly irregular, you must get the teeth corrected. Understand? Do you feel any breathing problem? No? There is no breathing problem. If your mouth is not open for breathing, then it's okay. As long as there is no problem, it's okay. Okay? Rama, please come.
I lost my premolar, sir, but again permanent set of teeth here. But again now another set of premolars are coming.
See, this boy asked I lost my premolars, but permanent teeth came, but other set of premolars are coming. But that is not true. That milk teeth, you do not have premolars. Milk teeth you have molars only, not premolars. But here is milk teeth are still there. Permanent teeth came, but still milk teeth are there. Understand? That's why there is a double row of teeth here. So you must observe. If you need double row of teeth, you must, because you have already milk teeth are still there. That has to be removed immediately, and teeth also proclaimed. You must get it corrected. Come to me, huh? We'll do it. Okay. Don't neglect, huh? Please. Amma. Yeah, it's asking why there are irregular teeth, isn't it? Because why the irregular teeth comes? Irregular teeth comes when your milk teeth were shedding, the permanent tooth should come in the proper place. At least once in at least 1 year. 1 year. So you have all forms in your hand, preserve it, come to me, and even this boy also, there are irregular teeth. That must be open. Yeah, still there are milk teeth here, but here this one also should be corrected. Even like open decay, I could see some decay. Because most of the children, they have decay, but they never visit dentist. You know, in America, I tell you one incident. In America, everybody must visit dentist once in 6 months. But one day, what happened? One team visited one home, one medical team. Why this girl is home, in this home, this girl visited or not visited dentist for 5 to 6 years. Then they have seen that, then they have examined that girl, that all molars in the mouth were destroyed completely. That cannot be repaired, almost 12 molars completely destroyed. Then immediately they arrested their mother, her mother, put her in jail, and they put this girl in the child care center. That much importance they have in America. Understand? So once in 1 year, you must come for check. India, you know, everything is possible. Come. Huh? Come. Getting pain? Come, I'll make one X-ray. ఈ బాబుకి ఒక చిన్న స్కాన్ తీసి చూద్దాం. చంద్ర yeah, still milk tooth is retained. It's not shedded. Still it is there. Permanent teeth came, but milk tooth still it is there. Because that will cause you problem. Immediately get it. Come, we'll just remove. That doesn't require any injection also. Simply we can spray itself. We can. This. Come. Yeah, just now explained about this joint pain. But Adya is asking why we get some sounds in the joint. The sound in the joint comes because that early stage of joint problem. Understand? Early stage of joint problem. At this stage, you need to visit a dentist and we check whether your bite is correct or not. Do you have proper bite or not? We just correct. If there is no proper bite, we try to correct that. And some precautions you must follow. Don't open your mouth too widely. Understand? Why? Annie, avulindrappudu ekku avuli open cheyadu. And don't bite hard things like the bones or very hard things. Understand? So these precautions you must take. Then slowly it will settle. Small precautions only for lifetime. You need to follow for lifetime. Okay? Still, if you have problem, come to me. I'll just check. We'll take X-ray for joint also. We'll observe. But don't neglect it. Huh? Yeah, she is asking me. My friend's brother was having problem. The enamel is not formed properly. Because yes, some children, enamel doesn't form properly because of some reasons. Fluoride area, fluoridated area. If there is more fluoride in the water, there is a disturbance in the enamel formation. So they do not get proper enamel formation. Like that, there are so many reasons that can be corrected. Corrected means we cannot create new enamel, but with the innovative materials that can be corrected. Okay? And your toothpaste is having enamel remineralization. This toothpaste is having hydroxide. Usually toothpaste have fluoride. Children should not use fluoride. I am telling you, do not use fluoride toothpaste. Use alternative to fluoride, because what happens to children, it will go into the stomach. If the more fluoride go into because of sweet, it will go into the stomach. If go into the stomach, fluoride will be accumulated. That is not good for health. And use hydroxide basic toothpaste, because this is hydroxide basic toothpaste. This will remineralize your enamel, because enamel is having hydroxide. This toothpaste is also having hydroxide. Small defects it will cover. And also this toothpaste is 100% safe. There is no heavy metals, because almost most of the toothpaste are having sodium lauryl sulfate, what you use in shampoos. But this toothpaste is 100% safe. No toxic material. Okay. Yeah, please. What is your name? Anna is asking why some toothpaste have poison. Correct question. Very good question he asked it. Yes, 90% of the toothpaste, they have toxic ingredients, harsh ingredients like sodium lauryl sulfate, like titanium dioxide, like parabens. Titanium dioxide makes the toothpaste white in color. Titanium dioxide is banned in Europe. It puts. But in 90% of the toothpaste, multi-national toothpaste companies most of the toothpaste companies are using titanium dioxide. So, but this is 100% safe. We use it, and again, okay. So many children are there, but I do not know whether you have time. I can answer, but if you have time, I can.
Sir, repeat your questions, please.
Repeated no, because already I answered na. Those questions please do not ask. New anything new question you can ask. You asked already there na? You already different question you want to ask.
Sir, is fluoride really essential in toothpaste? Are polymer chemicals really essential in toothpaste?
See, he is asking, please listen to me, please. Because asking good questions, this is very important for you for lifetime. What he is asking is a poisonous material ingredients are essential in toothpaste. He is asking because you know all these toothpaste companies are manufacturing toothpaste for the last 40, 50 years. That time it was they were not knowing their poison or harsh ingredients due to research and all development. So now listen to me. Now it came to know that most of the toothpaste are having poisonous and toxic and harsh ingredients. Now the science has developed. They cannot change their toothpaste because already people are accustomed. Children are using and people are accustomed. Now what I gave you, this is the safest toothpaste. You can see the ingredients. You can take the photo and put in ChatGPT. How safe this paste is. Like whatever toothpaste you buy, I'm telling you, whatever toothpaste you buy, you just see the label and take photograph, put in ChatGPT or Google whether they are safe or not. Understand? Don't blindly buy it and use it. Okay. So many children are there.
For 20 days, 50 days, I'm getting pain, sir.
See, he is also asking the same question. He is getting ear pain. We need to check up. We need to check your joint. We need to take X-ray. We need to check your mouth. Everything there is. This is the. We need to analyze completely. Come to me. Amma, we don't understand. No, Jan. Just the boys. You write down. And just when they come to us, she is a pedodontist. Like, come here. She is a pedodontist. Means she is specialized in post-graduation MDS. She is specialized in children's specialty. So we have 20 doctors in our hospital. We have all specialties. Understand? So we do every treatment. We have solution for all problems. See, what is the worst thing that can happen to do? How to prevent it? Mainly in your hand, only brushing is there. Understand? Brushing and food habits. One thing I tell you, see, why do you need brushing? When animals who are not using brush for clean their mouth, why do you need brushing? I'm telling you. When animals are not required brushing, why we are doing brushing? Animals, they eat raw meat. Understand? Listen to me. They eat raw meat. So self-cleansing. Even vegetarians, they eat grass. Self-cleansing. But what we eat? Pizzas, burgers, pastries, cakes. Yeah? Everything will be like cooked food. Previously, they used to like the vegetables, dumpal. They used to have ancient people. Now cooked food. Where we are having cooked food, that will be sticky, chocolates, everything, pastries. So avoid all these things. Even you have, clean your mouth, rinse your mouth. You better brush twice compulsory. You must brush twice. Okay? No, this mark doesn't have anything because this is for sealing. This mark is sealing. Black, red, yellow are nothing to do with this one. Understand? So this is only for sealing, whether black, green or anything. That is nothing to do with toothpaste quality. That is only that marking, that's sealing. Okay. Come. See, she is asking, any problem will be there with the wisdom tooth because wisdom tooth erupts between 17 to 18, 19 years. 25% of the population they do not get their wisdom tooth properly. Listen to me, please, because these are important questions for especially for girls. Boys also important for girls. I'm telling you because every day the pregnant mothers come with the weep. They come to us with crying they cry like anything because they are carrying pregnancy. That time they suffer with the wisdom tooth pain. They cannot use tablet, antibiotic. During pregnancy, not to use antibiotic. So during wisdom, they were getting pain while entering wisdom. 25% of the population, they do not get their wisdom tooth correctly. They will be getting pain. Before getting marriage itself, before getting pregnancy itself, they must check their wisdom teeth. If not come properly or it will cause trouble, they have to get the wisdom tooth removed. Understand? Because recently there was few astronauts went to space. Understand? They were having very good wisdom teeth, but they got it removed. Because if they go to space, they have to spend there for months. If they get any problem, no dentist is available, treatment not possible. Wisdom teeth is very much important and any problem is there. And that's why every 1 year if you visit the dentist, so they will tell you everything. No need of panic. Go to the okay. We cannot do it, it's not in our hand. Wisdom tooth, whether they will come properly or not, it's not in our hand. But whether it's coming properly or not, we can see. But this is like a genetic, hereditary. Because during the ancient time, they were having 4 molars in each quadrant. Now we are having only 3 molars because jaw size is reducing from ancient history, Bahubali and those times now people were, jaw was very, very big and they were accommodating each jaw 4 molars. Now only 3 molars. In that for 3 molars also, no space. Because we are eating soft, because we are not doing proper munching to the jaw. You see previously hen, not body, they used to have. Now 40 days chicken, 30 days chicken. You youngsters are not eating, unable to eat, unable to bite. They want soft one. You cannot eat their not body. Understand? So we are not using jaw properly. That's why jaw is become very small, slowly, in future generations also. Okay. Quick.
Sir, why teeth come front, sir?
He's asking why teeth come front, protruded teeth. Because first is hereditary. If your mother or father or anybody in your blood relation, you get mother, father, or mother, brother, father, brother, like that. That is hereditary. You may also get protruded teeth. Like open mouth. You open your mouth the whole day in the school, at home. You get protruded teeth. If you bite pencil or pen regularly like that, or 1 or 2 things will come forward. Like, so there are many reasons. So, every 6 months if you come to dentist, so nothing, no need to worry. Okay? Yeah. Come fast. All of you come, just almost same questions. All of you come, please. All of you come. You ask questions.
Sir, my teeth are breaking and they're not coming.
Breaking, not coming.
I already have
Yeah, he's asking why my milk teeth are shedding but permanent is not erupting. Sometimes permanent teeth may come slowly. You must have got the exam, the milk still it is there. What is your age? 11. Up to 12, you will get permanent teeth. No need to worry. Okay? Come. Yeah, she got root canal treatment, but why still it is paining, she is asking. And root canal treatment is highly specialized technique, and a specialist must do first thing. Mostly specialist must do, and the equipment should be there. And even in American standards, in America you get root canal treatment, there is 85 to 97% chances of success rate. But for that, if you want high success rate, you must visit a very good dentist. And if you have pain again, they may have to do root canal, re-root canal. We'll check. If you have this or not, we'll check why you is getting. We take small scan and you bring your OP sheet when you come. Yeah. Yeah, he is saying a double row, it is coming teeth, even you get permanent teeth again, backside teeth are coming like, because milk teeth do not shed. Milk teeth will not shed even you get permanent teeth. At that time you need to get your milk tooth removed. Yeah? I know, even sometimes very rare, that is very rare, but that has to be examined. That's why you must visit a dentist. Why sometimes it's like it is like unnatural, but some people it is done like that. Those roots will be removed. Understand? So some people they have only 28 teeth, 24 teeth, 32 teeth, sometimes 36 teeth. Because extra teeth will come. So why means in science it cannot be explained. Okay? Yeah, she is asking why we get ulcers inside our mouth. First thing is, why we get ulcers? Ulcers is because of stress, exam stress. First point is exam stress. If you don't have proper sleep, if you have vitamin deficiency, usually B12, vitamin B12, vitamin D, all essential nutrients, because of fast food culture, you are not having vegetables, fruits properly. In Japan, they live for 80, 90 years, 100 years, because a Vipjia, like 7 color fruits they eat every day. All fruits they are 7 colors, white color, like that. They eat, in their diet 30% they have vegetables and fruits. We are not having that, vegetables and fruits. Mostly fast food, or you get from Swiggy and Zomato. Previously, once in a while they used to have meat. And now because of this fast food culture, almost every day, alternate day, we are having all these things. Avoid packed food. Avoid fried food. Avoid instant food. These 3 are caused for the vitamin deficiency. Whatever your mom cook, eat it, then vegetables and fruits. If you have vitamin deficiency, then multivitamin sometimes, and when you get ulcer, so few days multivitamin you have to take. Yeah, most of the children, the problem is they get blood while brushing. Maybe due to permanent teeth eruption time, they get this problem. Or there is a gum problem because any calculus is deposited, any tartar is deposited, gum get irritated, then they get blood. You have to visit the dentist, they do scaling, and you have that form, please come to us, we'll check. We'll check. Understand? Okay. She's asking what is the difference between the paste which I got and to the normal paste. Listen to me, before using this toothpaste has got hydroxyapatite. Hydroxyapatite. What enamel contains? Enamel contains hydroxyapatite. Even this toothpaste contains hydroxyapatite. Only 2 to 3% of Indian toothpaste contain hydroxyapatite. This is very costly mineral. This will repair the enamel defects. And also 100% toxic free. There is no sodium lauryl sulfate. Shampoos has got sodium lauryl sulfate for foaming. Toothpaste also have, but this toothpaste 0% sodium lauryl sulfate. and 0% titanium dioxide, 0% paraben. Paraben will disrupt your endocrine function, but this one 0%. Titanium dioxide is carcinogenic, it's cancer-causing agent. 90% toothpaste have titanium dioxide. This toothpaste has 0% titanium dioxide. Like that, 100% safe, no heavy metals, 0% heavy metals. That is a specialty. We are making this toothpaste in our building only, in our hospital building only.
Chocolates will damage your teeth. There are some healthy chocolates with dark chocolate will they harm our teeth.
See, what is the name? Anusri is asking, chocolates will damage our teeth. Is there any healthy chocolate not will not damage our teeth? See, anything, chocolate, sweet, food or anything you eat, what you have to do is rinse our mouth, because children they eat chocolates, children they eat sweets. We don't say don't eat. Enjoy, but rinse. Then night brushing, morning brushing. When you do all this, you can eat whatever you like, but nutritious. Whatever you eat, just see how nutritious this is. How harmful to us. Whatever you do, just think before using, whether paste, whether food, or whether anything excess is not good. Toothpaste also, use little, not too much. Foaming is not important, our health is important. This is also good foaming with the healthy ingredient. Understand? Chocolate you can eat, sweet you can eat, but rinse. She asking how to protect her enamel. I am telling you, I already told you this good. You must use very soft toothbrush. Don't use hard toothbrush. Don't use medium toothbrush also. Very soft toothbrush. Like we gave to the teachers. That is an ultra soft toothbrush. Like how you clean our glass. Like that. Because teeth are not like a marble. Marble you polish it, that will shine. If you more brushing your teeth, your enamel will go away. Use very ultra soft toothbrush only. Don't use hard one. It's not a marble. So protecting enamel is just 2 minutes brushing. Morning 2 minutes, night don't do more than 2 minutes. Don't do less than 2 minutes. Good toothbrush, good toothpaste. And some people use powder, not good. Powder is not good. That will abrasive. That will spoil your enamel. Only toothpaste and good toothbrush. Okay? Yeah, why gaps will come? Gaps are coming between teeth. Gaps are coming between teeth during teeth formation. Gap formation will be there for some time. Or because of decay, there is a decay, there will be gap formation. We need to check what type of gap one have. Okay? Oh, thank you very much. Thank you all for a really wonderful kids. Really, you raised very good doubts. Really, I am telling you. Even adults cannot raise these good questions like this. Very good questions. All are valid. Very good questions. That shows how the what I can say. That shows the school reputation and how they are teaching you. Because really good school, like God's skill is a really good school, and your teachers are good. Because of that, you could able to ask us very good questions. I appreciate your principal. I appreciate all the teachers. For making you bright, and I could see the very cleanliness. Every child, how they are made very clean. Your classrooms, I see photos daily of camp photos. Very clean, very neat. I really appreciate. Thank you all. Thank you very much. You can visit anytime your hospital with your slip. Directly you can visit. No charges for the checkup. You can directly show in the reception. If any problem, directly approach our doctors. Understand? But once in a year is a must. Even though any problem is there, you must visit. Because see, just examination. Today how we examine, like that we examine. Immediately you don't do anything. We explain you completely. Then only we do the treatment procedure. That's why people think dentist is very scary. Going to dentist very no. Because from the childhood you must visit a dentist so that you could protect your teeth for lifetime, so that tomorrow in future your children also will be habituated. If you ask your first point is ask your mothers and fathers to brush their teeth night.